Yourself. Hi, folks. I'll turn it over to Congresswoman DeLauro in just a moment. She'll start with opening remarks and we'll open it up to questions. If you are not speaking or asking a question, please remain muted. I will prompt you to unmute yourself and ask your question. With that, Congresswoman DeLauro, go
Okay.
ahead.
Thank you. Thanks so much for joining us today. I really appreciate it. Um, it really is a kind of critical moment here. And I wish I had better news for you, but we are hours away from a government shutdown. And, the issue is what's at stake? What is the fight about here? Um, the fight is about, you know, how is it that we are going to safeguard against what was done in the big, beautiful bill that, would jettison uh, people from Medicaid, put into jeopardy almost $1 trillion in Medicare cuts, which will shutter nursing homes, community health clinics, cut biomedical research, and money for the Centers for Disease Control and Prevention. And we're in this position because these are the issues that we really need to hammer out in a bipartisan way. And the Republicans are refusing to address the healthcare crisis that they have created. Hours ago, I tried to offer an alternative resolution, the resolution that that Senator Patty Murray and I introduced. This is to address the crisis. It would preserve healthcare access for millions of Americans, but I was not even allowed to speak on the floor of the House. They gavelled me down. So we do face a cost of living crisis across the country, and that's true for Connecticut as well. And the price of basic necessities, food, housing, medicine has gone up and keeps going up. One of the biggest drivers of that increased costs are healthcare costs. And that's what we're fighting to rein in, is those rising costs to try to prevent the crisis from getting worse. But at every step of the way, which I could outline, I won't if you have questions about that, we are met with Republican opposition to measures to address the crisis, to sit down and to negotiate in a bipartisan way. Um, their signature legislation makes the problem worse for millions of Americans. I said Medicaid, it's a nearly $1 trillion cut. Medicare by over 500 billion. One and a half, not one and a half, 15 million Americans will lose their health insurance. Approximately 22 million Americans will see the average annual health care cost go up by over $700. And the Republicans didn't just slash Medicaid and Medicare. They went after the Affordable Care Act. The marketplace is there. And in Connecticut, as you know, uh, access, health care, and Husky are aligned with one another, and that is the Medicaid issues. But the premiums are going to go up exponentially without the subsidies that are in the Affordable Care Act. Over 150,000 Connecticut residents receive health coverage through the State Affordable Care Act marketplace. Access Healthcare, as I said, is Husky, and their premiums are set to skyrocket. Statewide, over 135,000 people will lose some financial support. About 27,000 will no longer receive any financial assistance. Covered Connecticut, which is a program which provides no-cost exchange plans to residents who make too much to receive Medicaid, but still earn less than 175% of the federal poverty level. They're in serious jeopardy. It would cost the state up to $30 million annually to replace federal funding that supported this program, and nearly 40,000 residents who received health and dental coverage. In the 3rd Congressional District, 37,000, people will lose health coverage because of the cuts. Almost 30,000 will lose access due to cuts to Medicaid. 7,700 people will lose access due to cuts in the ACA marketplace known as Access Health. So for those who are fortunate enough to keep their health care, their costs will rise even more. And that's for families at all income levels. A family of four earning $129,800 a year could see their premiums rise by $18,170. Imagine a family of four earning $64,000 a year could see their premiums rise by over $2,500. 60-year-old couple earning $82,800 a year would see their premiums rise by over $28,000. So the Republican shutdown means higher costs for everyone, more chaos, uncertainty for families across Connecticut during, as I said, a cost of living crisis. And that is all because they want to provide tax breaks to billionaires and to the largest corporations. So people want to know what is at stake here. This is what we're fighting about. It's not, and I'll speak for myself, we've been trying to negotiate a bipartisan resolution to this over the last several months, trying to get to that point where we have a negotiation back and forth and allow for gains on both sides. You can't have everything that you want, but you make gains on both sides. Everyone gets some of what they need, and so that is what Republicans have refused to do. And in fact, they control every branch of government, House, Senate, and the presidency. I think the American people know this. So let me just make a comment here. I think we all sent you a timeline that I released last week. But since the day that he took office, President Trump, along with the Office of Management and Budget Director Russ Vought and congressional Republicans, have been moving to shut down the government. They have been illegally freezing and stealing funds from communities across the country. The Republicans have ignored this lawbreaking. They've introduced partisan, extreme funding bills, which increase costs on families. They slash investments in health. They decimate education. They're increasing home energy prices and reducing housing and economic development. So the House Republican bill fails to make us safe. It defunds police and cutting cybersecurity measures. So, it's my view, and I would say that to my Republican colleagues. They're forfeiting their constitutional authority to an erratic president and a national budget director who would rather shut down the government than make the kind of deal with Democrats to lower the cost of living and to address a healthcare crisis. So, we're fighting for the bipartisan solution. And I've negotiated appropriations bills in the past with my Republican colleagues. We've been able to do it. Why? Because the interest was being able to provide services to the American people. That's not what we're talking about here today. And what we should do is to really lower costs. We should, eliminate the cuts that they're trying to make to health care and preserve health care. If the Republicans choose to shut down the government rather than take action, as I said, more than 20 million Americans will see their health care costs rise. That is enormous damage to people. So let me conclude there and let me take your question.
Right, again, unmute yourself if you have questions, and also feel free to throw them in the chat and I'll read them aloud.
Thank you so much, Congresswoman. You've been through a few shutdowns before. I'm curious if this one is unique in any way, if this feels different somehow. Feels different to me.
Well, you're right. I start from the premise that I never want to shut the government down. I worked very, very hard to negotiate so that we could have continue to provide the services that the American public deserves. There is a uniqueness about this shutdown, and that is because I think we've come to a point where we need to have, given the healthcare crisis that the Republicans have put us in, what they did with the big, beautiful bill, HR 1. I mean, this is sweeping. When you look at 15 million people being jettisoned from Medicaid, 22 million people seeing their costs go up. This is the first time in history that that's the case. So there is unique in that. And that's what we're trying to prevent from happening. And to talk about what, $536 billion in a cut to Medicare, which will happen over the next 10 years, because they breached the spending cap here, and all to provide that $4.5 trillion in taxpayer funds. And I think that one of the other unique pieces of this is that throughout this process, we've seen the administration, the OMB director, steal funds, the funds that have been appropriated by Democrats and Republicans, House and Senate, and feel that they can steal these funds and use them for whatever they want. They have no authority to do this. And so what we need to do is to address the healthcare crisis, and we need to have the assurances that once we come to any conclusion, that they are not going to come in, take the money, and spend it in whatever direction they want, and not abide by what the House and the Senate, Democrats and Republicans, have appropriated.
Let's go to Lisa Hagan with the CT Mirror next. Lisa, unmute yourself and ask your question. You there, Lisa? All right. Why don't we go over to Jonathan Salant with the New Haven Independent. Jonathan, feel free to unmute yourself and ask your question.
Hi, thank you for doing this call. Congresswoman DeLauro, you talked about the decisions, you talked about the other stuff, when you impound the money. How crucial is that, a deal on that, to any deal to have the spending bill passed?
No, it's very crucial, Jonathan. How can we, in the past, we have negotiated the appropriations bills where Democrats make gains, Republicans make gains. You don't get everything you want, but for the good of the American people, you move forward and you provide the services that they need. Now, if then you could have someone, which has been done. We appropriated money, and what they have done is stolen $410 billion, money that they've terminated or that they've frozen or terminated, and using for some other purposes. That can't happen. So there have got to be assurances that there are no rescissions, not stealing those funds, and that we can go forward with what the decisions are, Democrats and Republicans, House and the Senate, in the way that it has been historically.
All right. Let's go over to Ebong Udoma with WCHU, excuse me. Ebong, please unmute yourself and ask your question.
Okay, thank you so much. Congresswoman, what's the deadline for open enrollment is coming up? And the Republicans have said, let's just have a handshake deal and negotiate after we pass the CR. How soon do you have to have a deal to prevent healthcare costs from going up?
Well, let me just say this. Let me get your first point. I tell you, if you believe that a handshake deal with the Republicans, is something that is binding, I tell you, I have a bridge I want to sell you. This is unbelievable. We've seen what's happened in the past here. Every deal that they've come to has been abrogated in some way. And the fact that they've been stealing money that has been already appropriated by Democrats and Republicans, House and Senate, tells you something about how trustworthy they are and how good their word is. I don't trust them. We have to have the assurances now.
And then our final question is from Lisa Hagan.
Lisa.
She says, essential services continue in a shutdown, but some programs run out of money much sooner, and one of them seems to be WIC funding. Do you know how long Connecticut's reserves may be able to keep WIC going, especially if there's a prolonged shutdown?
Well, there's $150 million that WIC has in terms of a contingency fund. And we also have the ability to try to repurpose some money from 25 and 26. It doesn't last, it's not going to last for a very long time. And so, but my hope is that what we can do is, look, government shutdowns are awful. It shouldn't happen, and the Republicans are allowing this to happen because they won't come and do a bipartisan negotiation. They won't sit down with Democrats and do that. My hope is that what we can do, that the contingency fund can help us through. In other areas, there are programs that can go through, SNAP and others that can go through November. And so we will hopefully see that the Republicans will come to the table and deal with a negotiation to move forward. And there is, states are going to have to take a look at, what a plan B might be as well. But there's $150 million in a WIC contingency fund.
Do we have any more questions?
Somebody asked about open enrollment. That starts in about a month. Now, you should also know, and you probably do know, the Connecticut Insurance Department approved an average of a 17% increase. So we need to be dealing with this stuff as soon as possible. These premium subsidies are critical for people that are having health care in our state and in the country. They say what we're talking about is $1.5 trillion in new spending. They have $4.5 trillion in tax cuts. And, this is, they have a series of talking points that bear no relationship to the reality. The only reality is that they do not want to sit down and negotiate a bill that keeps the government open and really allows government and members of Congress to do what they were elected to do, and that's provide for the good of the American people, to deliver healthcare services, the biomedical research that needs to get done to people facing a cancer diagnosis, the mental health services if they need, if a child or loved one has mental health issues, and we know that the mental health crisis is upon us, especially with young people. Medicaid, which services provides coverage to children, to the disabled, to low-wage workers, to seniors, to all these folks. I listened to a woman this morning who has twin boys, both of them who are autistic. Medicaid is a lifeline for her and for her children. So this is what has to be rectified. It can get done, but it has to be the will and the choice of the Republicans to come to the table to negotiate.
That's all our questions.
Thank you. Thanks very, very much.